Hello and welcome to our listeners from around the world. This is JAMA Network Open Conversations. I'm Angel Desai, Associate Editor for JAMA Network Open. Today we are speaking with Drs. Eleni, Jaswa and Dr. Marcelle Cedars about in utero exposure to maternal COVID-19 and offspring neurodevelopment through age 24 months. Welcome to you both. To begin, can you please introduce yourself?
Sure. My name is Dr. Eleni Jaswa. I'm an assistant professor of OBGYN at the University of California, San Francisco.
And this is Marcelle Cedars. I'm a professor also in the Department of OBGYN at the University of California, San Francisco.
Thanks to the both of you for being here today. I really enjoyed reading this study. Clearly, there are still so many unanswered questions about the downstream effects of the COVID-19 pandemic. Can you start by giving us a little bit of background about the study?
If you can remember back to spring of 2020, there was this novel virus, the coronavirus SARS-CoV-2, and there was a lot of concern about the impact on the population. And we were particularly concerned with two vulnerable populations, and that was pregnant persons and their children, because pregnancy is a unique time of vulnerability, both for the mom who has an altered immune system with pregnancy, and particularly for the pregnancy and the child, because in utero exposures can have lifelong consequences. So with these concerns in mind, we began recruiting in April of 2020. And a little bit like building the plane as you're flying, the study was modified as we went along, but our goal was to capture a large population across the country, uniquely to get patients early in their pregnancy. Most patients don't see an obstetrician until the late first trimester, early second trimester, particularly at a time of shelter in place and decreased office visits with physicians. We wanted to try to capture patients early in pregnancy. So we started by recruiting with the Society of Assisted Reproductive Technology, or SART, which are fertility practices, because we thought these are practices that see patients literally at the moment of conception, and we could capture patients early. But as evolved information about the coronavirus and its infection, COVID, it seemed that underrepresented populations were perhaps most at risk to become infected and to have more serious consequences. So we shifted gears and started utilizing an online platform called Baby Center that reaches over 32 million individuals and 90% of first-time expecting parents. And so we thought this would give us a broader population. So the primary exposure for the pregnant person was done in two ways. One is by self-report, because testing was becoming more available in the population, and also through the collection of dried blood spots, which we felt was a way to collect samples from patients who were sheltering at home, who were remote from a testing site, or didn't have healthcare access. And we had validated previously that the blood on the dried blood spot cards could be used to get a serologic approach to measuring the antibody for the coronavirus SARS-CoV-2. That was our exposure. And for this study, we wanted to look at childhood neurodevelopment because there's very clear information about risk to the fetus from exposure to viruses such as the flu, rubella, and we didn't know what the risk was to this population with this particular virus. And so we wanted to look particularly at neurodevelopment, which has been shown to be impacted by the immune changes of the mother, even if the virus itself doesn't cross the placenta.
You use the results of the ASQ3 questionnaire as your primary outcome. Can you tell us a bit about that, what that measure is, and how it's used?
The Ages and Stages Questionnaire, third edition, is a validated screening tool that assesses for neurodevelopmental delay. So there are 5 domains that birth parents discuss about key milestones that are developmentally appropriate at different ages that they see their children performing. And the different domains include things like gross motor skills, fine motor skills, communication, problem solving, and social skills. And it is a systematic way to examine how frequently someone's child is performing those developmentally appropriate milestones.
Can you tell us what you found in the study?
So we ended up recruiting over 7,000 pregnant people to participate in the study. And of those, 2,003 met inclusion criteria with adequate data available for our analysis. There were assessments of the children that took place at 12 months of age, 18 months of age, and 24 months of age. And at the 24-month time point, there were 1,523 children with neurodevelopmental screen data available. When we looked at the raw prevalence of positive screening tests, that means a child at risk for neurodevelopmental delay, the prevalence was 19% among the exposed offspring whose birth mothers had had COVID-19 during pregnancy versus 17% for the unexposed offspring at that 24 months of age. And this difference was not statistically significant. Furthermore, upon adjusting for confounders, the estimated percentage with neurodevelopmental screening tests that were abnormal was 16.8% for the exposed offspring versus 16.9% for the unexposed offspring. And so this was equivalent to an adjusted risk ratio of 1.01. So effectively, we saw absolutely no signal for any risk for abnormal neurodevelopmental scores among exposed offspring.
I think this study is really a helpful additional piece in trying to understand this question about the effects of in utero SARS-CoV-2 exposure on subsequent neurodevelopment. There's an excellent invited commentary going along with the paper that I think really highlights the importance of this topic, but also the challenges in achieving sufficient power for this type of study, and also the potential limitations of different types of measures that are used for this purpose, including the ASQ3, among others. So I wonder if you could contextualize this study and its findings in the broader literature.
There have been some papers that have addressed this. Most have also been reassuring in their outcomes, showing no effect. There was a study that looked at EMR records that did show some potential association, particularly in male offspring. I think it's very difficult to get the perfect study to look at this, but we did have a large number of individuals, even though our number of affected individuals was small. I think one of the other problems, as I discussed in the recruitment, is that despite our efforts to get a large number of underrepresented and potentially disadvantaged populations, those numbers were still quite low. And we did see some impact of socioeconomic status on outcomes. So I think that most of the data, including our study, are reassuring about the potential risk. But I do think that children need to be followed for longer. I think we continue to need larger populations. And I think how the SARS-CoV-2 pandemic rolled out in the absence of pregnant persons in a lot of trials really showcases how important it is to get at this population very early on, both in terms of risks and in terms of vaccines and development of treatments.
Absolutely. I would just echo that. We know pregnancy is the most dynamic time of human development, and there are critical windows, and nurture in the nature-nurture debate, nurture really begins in utero. And so being able to kind of follow more diverse populations of children for longer periods of time and make sure we understand what risks can be imposed to their future development and lifelong health consequences through adulthood is a really important thing to keep track of.
I wanted to ask, just as we are starting to move into viral respiratory infection season, if you had any thoughts or additional points for individuals who may be pregnant, who are wondering how best to protect themselves in this setting.
Sure. I think that following your doctor's advice is always a great start. We have previously published that the COVID vaccine itself is quite safe in pregnancy in JAMA Pediatrics earlier this year. And so I think following the advice to get vaccinated, do all the normal healthy things as far as hand washing and avoiding folks who are sick to the extent that that's possible is always best practice. And at the same time, to have some reassurance that even if infected with COVID or other cold viruses, at least this paper and this cohort data suggests that a COVID infection does not convert to abnormal neurodevelopmental risk for future babies.
Before we wrap up, any final thoughts regarding this topic? Anything we didn't cover?
I heard today driving in to work that there's a study that has come out that's actually shown that infants born to mothers who did not have the COVID vaccine were at higher risk. And infants were one of the highest mortality groups other than those over 70. And so I think the paper that Eleni mentioned in terms of the fact that the vaccine itself did not increase risk to the child should be very reassuring to pregnant people, and they should be encouraged to get the vaccine, both for their own health, because pregnant people still do get sicker with COVID, but also for their child's welfare.
Absolutely. I think the data is really clear that babies are protected for up to 6 months after delivery following maternal vaccination during pregnancy.
I think these are some really great thoughts to end on. Thank you so much for speaking with me today about this really great topic and paper. I'm Dr. Angel Desai and have been speaking with Drs. Eleni Jaswa and Marcelle Cedars about in utero exposure to maternal COVID-19 and offspring neurodevelopment through age 24 months. This episode was produced by Shelley Steffens at the JAMA Network. A link to the manuscript can be found in this episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or wherever you get your podcasts. Thanks for listening.